For my presentation proposal for this class will be on Parkinson's disease. What is Parkinson's disease? It's a neurological disorder where it affects the brain. The body shakes non-stop. Parkinson's disease is characterized by resting tremor and slow movement known as bradykinesia, described by James Parkinson in the 1800s. It is a disease that has been linked to genetic factors that could be triggered by environmental components. Chemically, there is subsequent research show that treatment with dopamine improves symptoms. Since then, advances have produced new medications and even surgery to help relieve the symptoms of Parkinson's disease. About 90,000 people in the United States are diagnosed with Parkinson's disease every year. The primary risk factor is age. A lack of dopamine in neurons in the substance Niagara and Lewy bodies are primarily involved in the brain. Dopamine is a neurotransmitter that is also deficient in these areas. The cause of Parkinson's disease is a large genetics component and also environmental factors that can increase the risk of getting Parkinson's disease. A loss of nerve cells plays a part in causing Parkinson's disease. The substantia nigra is a small area in the midbrain. The neurons produce a high concentration of dopamine. In Parkinson's disease, these neurons deteriorate. The results of losing these neurons cause problems with movement like tremor, stiff muscles, and slow movement. The basal ganglia are connected to the substantia nigra, and when dopamine production is reduced, motor functions are further impaired. These are also impact on cognitive functions and emotions. Lewy bodies are clumps of the alpha-synuclein proteins found in nerve cells in areas of the brain that control memory and motor skills. Lewy bodies are one of the causes of Parkinson's disease, which can lead to dementia for some Parkinson's disease patients. According to doctors, dementia and Parkinson's disease have many similar symptoms. It is an unknown reason why Lewy bodies appear in the brain and cause abnormalities, cause nerve cells to die, and person loses their brain tissue. There are different types of signs and symptoms of Parkinson's disease. The main symptoms are tremor at rest, slowness of breath, muscle stiffness. There are physical symptoms: dizziness, loss of balance, nerve pain, cognitive psychiatric symptoms, depression, anxiety, dementia, mild cognitive impairment. Parkinson's disease is diagnosed by getting a detailed history and a physical examination. The neurologist will test the patient's walking and see if they have tremor and if the muscles are stiff. The treatment options for Parkinson's disease are physical therapy, occupational therapy, medications, and rarely surgery. The kind of medication a patient with Parkinson's disease would take is levodopa, dopamine agonist, monoxamine oxidase B inhibitors. Believe it or not, Teo dancing can help patients with Parkinson's disease. Most important for a patient living with Parkinson's disease is a positive mindset. Depending on which stage you are in life with Parkinson's disease, each stage treatment option is different. It depends on age, other conditions they may have, and the severity of the symptoms. Stage 1 and Stage 2 of Parkinson's disease are mild, not likely to affect day-to-day function or life expectancy. The early signs are tremors, shakes, changes in posture, gait, facial expression. Moderate symptoms become more noticeable in Stage 2. Difficulty in walking, muscle stiffness, notable changes in posture, and speech difficulties. In Stages 3 and 4 in Parkinson's disease, a patient will have difficulty with balance and movement. Still independent, daily tasks can be challenging. Falls are common, may cause severe falls and injuries. In Stage 4 of Parkinson's disease, symptoms severe, unable to live alone due to safety concerns. Not able to stand without assistance, require help to move and perform other tasks. In Stage 5 of Parkinson's disease, a debilitating person may be unable to stand or walk, may require a wheelchair. Hallucinations, delusion are common, affect 20 to 40%, prone to injuries, infections, could cause complications or be fatal. Most people still have a normal life or near life expectancy. There have been a lot of famous people who have suffered from Parkinson's disease. Muhammad Ali, one of the greatest boxers of our time, suffered from Parkinson's disease after years of boxing, getting hit in the head a lot, damaging his brain. Back to the Future and Family Ties star Michael J. Fox was diagnosed with Parkinson's disease at age 29. It's very rare for a young person to have Parkinson's disease. It's mostly common in senior citizens. It's an unknown reason why Michael J. Fox has Parkinson's disease, and he was not a boxer. Former football quarterback Brett Favre suffers from Parkinson's disease after years of playing football, causing a lot of brain neurological damage from getting head trauma. Comedian Curb Your Enthusiasm Richard Lewis, when he was diagnosed with Parkinson's disease, he retired from stand-up comedy, focused on writing and acting. He passed away last year. Bob Hoskins from Who Framed Roger Rabbit retired from acting due to Parkinson's disease. He passed away in 2014. In the last 3 years, from 2022 through 2025, I was a caregiver for my 95 who recently turned 96-year-old grandfather this month who suffers from Parkinson's disease. He had a hard time accepting that he suffers from the disease and can't do the things that he used to do, the things that we take for granted in life. Before his diagnosis, we didn't think that he had the disease, but a neurologist confirmed it. My grandfather did not take the news well when the neurologist told him there was no cure for Parkinson's disease. Last year in my old college at Empire State College, in one of my classes I took, I made a film based on the short story Tuesdays with Morrie by Mitch Albom. The title was changed to Conversations with My Grandfather. I asked him how's he feeling living with Parkinson's disease. He said he had never heard of it before, wishing there was a cure for it. Despite my grandfather doing his physical therapy exercise to help manage his Parkinson's disease, he gave up on his exercises and he sadly declined very fast. Me and my family had no choice but to put him in a nursing home. He did not see the positive how the exercises helped him manage his Parkinson's disease. My grandfather had a hard time maintaining balance, could barely walk or get around, was out of breath, had a lot of incidents where he fell. He was lucky nothing serious happened except for bruises and sprains. His memory was also declining. He had a hard time keeping up in conversations. One of the areas of research is to deliver a concentrated medication that is released through a skin patch. Most of these medications are designed to increase the amount of dopamine to improve symptoms. One of the major problems is maintaining a constant level of medication where there is an on time and off time. As I mentioned, the skin patch may be a solution to this problem. Other medications are used to enhance the effect of dopamine or to prolong its effect or treat side effects. There are two methods that are being studied for continuous medication availability. One is continuous infusion under the skin of carbidopa, levodopa. Another is by using a patch with the same medication that gets absorbed to the skin. Instead of increasing the amount of medication, newer research is looking at the ability to increase the number of dopamine receptors. The name of the oral medication is called tavapadon. Research is being done in trying to slow down the progression of the disease. The cause of Parkinson's disease is due to protein clumps in the brain called Lewy bodies. Some cancer drugs and drugs for diabetes are being studied. Genetics is a very small portion of the total cases of Parkinson's disease, but it's an area of research. Despite no cure for Parkinson's disease, it can be manageable with medication, exercise, and diet, and a positive mindset.